Today we are going to share our dental experiences with you. We go to Dr. Grace Ordoñez. She was voted the best dentist in Cuenca by Gringo Post viewers. That came out, I think, last week or maybe 2 weeks ago. We really like her. We think she's pretty freaking awesome. She's nice. She speaks good English, which is muy importante. Her offices are state-of-the-art, and we are going to show you those offices. We're going to run through the costs that we incurred, and JP recorded a procedure, so we'll show you that as well.
It's time. Hola. Hola. ¿Cómo está? Buenos días.
Buenos días.
Hola. ¿Cómo está?
Por favor. Gracias.
¿Todo listo? ¿Todo bien?
Sí, todo bien.
Chévere.
Listo, sí.
Aquí vamos. No está nerviosa, ¿no? ¿No?
What?
No nervous, right? Un poquito.
Oh.
Everything is gonna be perfect. No worries, no worries.
You do whitening?
We do. It is about 3 appointments, 1 hour each time, once a week. We use the light for the whitening. It's a special light that makes the material goes deeper and stays the whitening longer.
Oh, okay.
And also, very important, we are running a special.
Oh.
Don't tell anybody.
Okay. All right, we won't put that on the channel then.
No, it's okay. No,
Oh, okay.
I was just joking.
Oh.
It's okay.
How much does that cost?
It's normally 175. Now we are doing it for 150. The 3 appointments.
Okay.
I mean, the whole treatment.
Oh, wow.
Okay.
That's great. How long does the whitening last?
Each patient reacts different.
Of course.
Could be 5-6 months. Could be 8 months.
Okay.
Okay. But what I recommend after the whitening is to keep doing it at home. Home whitening. I can make a tray, and also I give you for a very low price the tray and the material for doing at home yourself.
Oh, okay.
I
Great.
can explain you everything, and that keeps your teeth very nice and white.
That sounds wonderful.
It's very good, yeah.
Of course, it has nothing to do with the crown I'm getting today.
No.
I'm distracting myself.
All right, good luck. I'm
Thank
gonna
you.
leave.
Okay. Bye.
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 I'm done.
There you go.
Am I swollen?
Are you numb?
A little bit. It went much better than expected. Maybe we can talk though after this side is worn off.
Okay.
Hi veggie lovers! I'm back from my dentist appointment and it went extremely well. Very happy to report I did not need a crown after all. Yay! Dr. Grace said she planned on the crown because she didn't know what she was going to find underneath that old filling. So we removed the old filling, we replaced it with a new composite one. I was there for an hour. The cost was $70 and it was a very painless experience. She started off by giving me a couple drops of Novocaine, which I barely felt, just enough to numb me before she put in the rest of the Novocaine, and it was easy. I'm quite pleased. I am relieved. I will admit I was a tiny bit nervous going in because I didn't know what to expect.
And I had my teeth cleaned too. It was, what did I say it was? 30?
You said 20.
It was $20, and then she found a pocket thing that she wanted to check again in a couple of weeks. So I went back to get that checked out with $10, and everything was fine. And she didn't have me get X-rays. She said there's nothing wrong with my teeth, and if there's nothing wrong, there's no need to get X-rays. So in the States, you know, you have to get. They want you to get X-rays every year, but you know, X-rays are not that safe.
Yeah, that's why they put the giant lead thing
Yeah, that's
on
why
you,
you
and they
have-
run out of the room.
Yeah, they put lead across your torso, but not your face. You know where your brain is.
I should mention they did put the lead thing on me too.
Yeah.
So I was protected.
Yeah, that's good.
Anyway, so this is so far so good. I have another dentist appointment coming up on Monday and then another one on Tuesday because I have a couple old fillings that need to be replaced. And one of them is right next to the one I got replaced today. She was a little concerned about that one too, so fingers crossed I don't need any additional work. The interesting thing though is that the other fillings that I have to get replaced are amalgam, which means they contain some mercury. So she has special equipment to safely remove those without exposing me or the patient and the doctor and Veronica, who is her assistant. So we're going to film that, and
Yep.
we're going to learn all sorts of new stuff about dentistry here in Ecuador. Oh, another thing I wanted to mention, she did quote me how much it was going to cost for a crown. And a crown, if you use the 3D printer technology, the crown costs $375. So give you guys an idea about pricing. The appointment I have on Monday is $45. So it's $45 per tooth or per filling to replace those.
And we're going to show you all that too. So this is our intermission.
Yes. Yeah, so I'm free for the weekend.
Yeah.
I have no restrictions. She said I could eat like normal. The numbness is wearing off. It was pretty minor.
Yeah.
I can drink water
Yeah,
without
good.
it sliding out of my mouth.
All right, are you done for today?
I'm done for today.
All right, we will see you all after the next appointment, or during the next appointment.
Yes. All right. Bye. Bye for now. I'm back at the dentist to get my fillings replaced. These are old amalgam fillings, and Dr. Grace has some sort of special machinery that she uses to safely remove those old fillings that contain mercury and replace them with composite. So we're going to show you what that's all about.
How was your weekend?
Very nice. Good, thank you. And yourself?
Very nice, actually. A little busy, but very nice, relaxing.
That's good.
I want to let you know, if you don't know, I try to avoid Novocaine as much as we can.
Okay.
For me, it's like chemicals in your body, because most of the time, 95% of the patients and the patients that I work with doesn't feel anything at all. In case if you start feeling some discomfort, please let me know. Of course, I'm gonna use it.
Okay.
But if we can avoid it, it's better.
Oh, I agree.
Okay?
Okay.
Great. So what we are gonna do is I'm going to isolate the tooth, and I'm gonna use the vacuum very close to your mouth to absorb the maker's vapor. So nothing is gonna go to your mouth, to your throat.
Good.
Okay? As I told you, this is a procedure that we have, or I like to put attention. Nowadays there is still lots of dentists who takes amalgam without doing this procedure. Lots of dentists.
Oh, I know.
Yeah. So, but for me, if we read in the Wikipedia what about mercury, it says the most toxic material. That's why the doctor said, oh, not too much seafood because of mercury.
Right.
But we have in our mouth a lot. Okay. So I'm gonna go very nice, easy, very careful. I'm gonna start with the, let's say, small filling, or the smallest that you have, so you know how it works. You're gonna feel more relaxed about it. I don't want to start today with the biggest.
Oh, okay.
Still, you don't have very big fillings. You have small fillings, but I would like to start with the easy one.
I like that,
in
too.
order to let you know more comfortable, and you get more confident with me and with the procedure. Okay?
Okay.
Also, I'm gonna use the glasses in order to protect your eyes. Those black
Thank you.
glasses are also going to help you to relax, because I don't know, for some reason that works for me. Black. And now once that my patients wear those, the second appointment they are asking for those, because it really works and helps to relax. This is a clamp that's going to help hold this piece in your tooth.
Okay.
Okay?
Yeah, I imagine it's kind of hard to get it to stay.
Is that okay for you? It's not hurting, right?
Uh-oh.
So we are going to... Dígale a Carla que lo traiga. Venga para que me ayude con la máquina. We are going to use the high suction plus the machine. No pain, right? Okay. It sucks. You can see how this moves in. See? Look. Huh? So it's gonna grab all those vapors. In order to make the filling, I'm gonna need to take off this, because it's one part of the filling is gonna go in between the teeth. That's it. We finished with the amalgam.
Awesome.
No pain, right?
A couple of times I had a little like twinge.
Yeah, nothing bad.
No.
Great. The most important thing is that we
Yes.
avoided Novocaine.
Yes, I agree.
Lots of patients, and honestly, they asked me Novocaine at once. I said, Betsy, as soon as you feel it, you can let me know. And now I'm gonna start with the filling. Okay. I'm gonna use composite, a nice German brand composite. It's very nice. It's very good material. I'm gonna clean the tooth a little bit. Just brush. Amelia looks very nice. I'm happy.
That's good.
No pain, right? It was deep. But the nerve is still not that close. Still very well protected with a very good amount of dentin. Okay? You have very nice teeth. They look very healthy. This is the material that's gonna help the composite to attach so good and make a chemical union with the tooth. Are you okay? No pain, right? Lots of patients comes from Canada to get the amalgams get removed. From the States also, but mostly from Canada. I had a patient who was shaking lots. He used to, when he was walking, he used to hold the walls in order to feel more stable. And he got a test in Canada, and the problem was he had lots of mercury in his blood. Yes, lots of mercury. That was the problem. Even he took off crowns because he had underneath crowns he had amalgam. We took off all those crowns in order to eliminate the amalgam from his teeth. The last layer of composite, I should put just 2 seconds of light because the material reacts to light and gets strong, hard. If you want, I can show you with a mirror how the feeling looks like, so then you can show Amelia. Yeah, it's very nice. Yeah,
because it's hard for me to see.
Yeah. Oh, waving.
Gracias. Hi, veggie lovers. I am done with the dentist. Woohoo! And my smile is very happy.
But the bank account is not.
Whatever.
She's going to put us in the poorhouse with her smile.
Please.
It's worth it, though. She has such a beautiful smile. I don't want her to be toothless.
Well, and this really was not very expensive.
No.
Not at
compared
all.
to the States.
Exactly.
This would have been several $1,000s back in the States.
Yes, I had several appointments. I got several fillings replaced. I'm going to run down all the charges for you.
Yep.
From the very beginning, which all started with the cleaning back in December.
An innocent cleaning.
An innocent cleaning, yes. This is why you need to go to the dentist every 6 months. So I got that dental cleaning and that minor filling repair done, and that was $40. Then I went and got x-rays. That was $8. I had a specialist come and meet with me because I have a really bad habit of clenching my teeth, especially when I'm stressed and when I'm sleeping. And that has resulted in me needing all these fillings replaced. What's cool about Dr. Grace is that she has a specialist come to her office. So that visit was $20, and that included an exam and the molds for me to get a night guard or a placa.
Placa.
Yes. She has other specialists come to her office as well. While I was in there getting a filling replaced, she had a client in meeting with an oral surgeon. My first filling was $70. That was the one where I thought I was going to end up having a crown, and it turned out it just needed to be a replacement filling. That one had been replaced earlier, so it was a resin one, or maybe it was just an old one. Bottom line is it was not amalgam, so it was $70. My second filling that was replaced ended up costing $90. That was the one that JP recorded. That one was much more complicated because it was a lot bigger and deeper than we had anticipated. But still, it was $90, and it took an hour. And the rest of them were a piece of cake. So I had a few other ones replaced. The amalgam to the new resin fillings, those were $45 a piece. And finally, the actual night guard itself cost $200. So my total for all of that work was $608. I don't think that's bad at all.
Yeah, that's not bad.
No, when I went to the dentist a couple years ago, I had a teeny tiny little filling that needed to be replaced. Did not require any Novocaine. It took 20 minutes and it cost $200. A cleaning with x-rays, I think, was $200. So to put it in perspective, I don't know how much things like crowns cost, but I'm pretty sure they're more than $375.
Yeah, they are. I think my mom just had one. I think she said it was $1,200 for one crown.
They're pretty pricey.
Yeah.
And I know where we were in Denver, that Denver is one of the most expensive places to get dental work done. So you might be able to find some places cheaper in the States, but we're not in the States.
Nope.
We're super happy and impressed with the quality of care, the quality of equipment at Dr. Grace's office. It's nice that they all speak English. That's very helpful. I appreciate the fact that she didn't use a lot of Novocaine. She said if I needed it, that she would give it to me, but she goes with the philosophy less is more. So I was pretty happy about that, because I have to admit I was a little concerned thinking I was going to go and get fillings replaced back to back, and then, gosh, was I going to be able to talk? But that was not the case.
Yep. And we also paid in cash. Now, they
Yes.
do accept credit cards, but there's an 8% cash discount. So a lot of places do that here. They'll give you a cash discount for paying in cash. So we opted to do that to save the extra money.
Yes. So $600, quite happy. My mouth is happy. Life is good. Maybe I'll go eat something now.
Yeah.
That's all we have for you today, veggie lovers. Hopefully you found this helpful.
We'll put the contact info for Dr. Grace in the description below so
Yes.
that you can contact her if you need a dentist appointment. And medical and dental tourism is a big thing here in Ecuador because the cost of things are so much lower. So it's a good way to get an awesome vacation and your teeth cleaned and cavities filled and
Whatever.
what do you call those? Crowns?
Crowns, root canals.
Yeah,
She
you'll
does.
save a lot of money and you can
Yeah.
apply that to an awesome trip. All right, veggie lover, that's all we have for today as the neighbor starts banging loudly in his house. So if you have anything that you'd like us to video, just let us know in the comments and we'll do our best to get that filmed for you and answer your questions.
Yes, absolutely.
And please remember to subscribe. You don't want to miss out on our future adventures. We have some really cool stuff coming up.
We do. Ring that bell.
Ring that bell so you
And
get
you'll
notified.
get notified.
Yep. Great. All right,
right.
we will see you all next time.
Ciao. I am not banging the table.
You are
I'm going to bang you.
Oh, really?
And not the way you want. Today we are going to share our dental experience with you guys. No, I don't want to say you guys.
Yous guys?
No.
Going to share our dental experience with yous guys?
What the hell is that?
That was my horrible Italian
That was pretty bad.
New York accent. Brooklyn.
Okay. Today we are going to share our dental experiences with you. I don't know what else to say.
Please wait for me to get adjusted and stop talking. Are you gonna talk? Like at 1 second pause is fine. Like 10, 15 seconds is a little too long.
Okay, are we ever going to get this done?
All right, we can do this.